And now let me introduce the next speaker. It's Nurse Cassandra Upchurch. Nurse Cassandra Upchurch, she's a Master of Science in Nursing and registered nurse and a legal nurse consultant. And she became a registered nurse in 2007 after attending the Westchester University. She started her first registered nurse role at the University of Pennsylvania Hospital in the Trauma Surgery and Surgical ICU. And after being in this role for some time, she continued into the additional nursing experience, including critical care, acute care, and home health and hospice care, and managed care and long-term care, and leadership and nursing administration, and bloodless medicine, and nursing education, and patient blood management, and legal nurse consulting, and infection preventionist, and transplant coordinator, and travel nurse. And Cassandra completed her Master of Science in Nursing Administration from LaSalle University in 2021. And she's the owner and lead instructor of First Aid and CPR Academy LLC and A.N.I.T.A Clinical Consulting LLC and Quality Caring Professionals Training Center LLC. She also functions as an adjunct professor at Widener University Nursing Program. And Cassandra has published multiple articles in medical and nursing journals. She has presented at national and international conferences related to bloodless medicine, business, and patient care delivery. She is a writer, course developer for NETCE, and subject matter experts writer for GW, and clinical director for Tender Care Hospice LLC. The theme of her topic in his talk is nursing and advanced derivatives in bloodless medicine. So we can hear her words as from the, I think, a multiple dimension. Cassandra Upchurch, you have our attention.
Hello, everyone. Thank you for having me today. Thank you for being on. Today is a very important, or the entire week is a very important conference. So I know I've benefited greatly from hearing all the great information from all the speakers, everything we've learned. So it's definitely beneficial to have this exchange of knowledge, but also to be able to educate the community and those that may not be working in the bloodless medicine environment regarding the importance of bloodless medicine as a discipline. So I'm going to talk about nursing and advanced directives in bloodless medicine. And this talk is really to complement everything we've been learning so far, that there's a lot of medical and surgical techniques, but there's a large component where, again, as always with healthcare, the patient is the focus and center of our care delivery. So we want to make sure that we always have a way to be able to empower them so that they can make an informed decision. And bloodless medicine definitely allows nursing to be a huge contributor and collaborate in building that framework that makes a bloodless medicine to help drive that autonomy and individualized care for our patients. So we'll talk about that somewhat and the role of the nurse in that respect. So we're going to talk about the impact of nursing, implementation of the process of bloodless medicine, and advanced directives. So just a snippet about nursing as far as it contributes to the healthcare field. Again, the focus on this is on the nursing discipline specifically as part of the interdisciplinary team. So we do know that nurses RNs specifically make up the largest healthcare profession. So in the United States alone, we have 4.8 million RNs. And that's just licensed nurses that are RNs. That's not including all the other disciplines that fall under the umbrella of nursing as well. So definitely a huge profession, which means that that kind of reach makes it very impactful. So there's a lot that can be done on behalf of our patients when we have that kind of outreach as a team. One of the other things we want to consider is that nurses have also been one of the top rated professions with the Gallup poll as far as top ethic ratings. And so we all know that when it comes to ethics and being noted by patients as one of the most trusted professions, it means just that it makes it a lot easier and a lot more, it makes it possible to build strong relationships with patients. One thing that we do know that is that there's always a barrier in healthcare and a delay in decision making and misunderstanding when a relationship and trust is not established because the relationship is not strong. And so this definitely impacts the patient and their ability to make an informed decision. So again, and we're also going to talk about the diversity in nursing roles. Nursing typically, like most other disciplines, exists in pretty much every area of healthcare. So we'll look and see what those areas are as it relates to bloodless medicine and surgery. So nurses' role in healthcare as it relates to nursing in the United States. So we have some very specific roles that are in the acute area and some outpatient areas as well. So you'll find nurses in these roles at the bedside, nurse leadership, your advanced practice providers being your CRNAs, your CRNPs, your CNS, your quality assurance individuals. They have roles in the OR, your coordinators, and the Bloodless Medicine program, in addition to your managers and directors. That's a part of leadership, and your nurse educators. All these roles are very important because that means that this is extended reach that we do have. These are additional opportunities for impact that we do have. And so this education that develops from the core in bloodless medicine, we can use those channels to help reach patients, to help reach the community as well, but also to change practice too, because of course, everything starts with research, and that's how we put that into practice. And so we want to keep that in mind when we understand that the strategies, everything that we do from a medical, surgical, or clinical standpoint, absolutely has reach in other areas as well as it relates to nursing. So we'll talk about that as well, as far as those pieces that build up the framework that really helps us to do what we do as healthcare providers, because we know that bloodless medicine is not just a discipline or strategies that will exist or is impactful just in the hospital encounter or during surgery, but also it starts before the patient is even in the hospital and it continues even after their discharge. So especially for our bloodless medicine patients, it definitely has a lifelong impact. And so although management will always be a part of the process, maintenance is very much part of the process. And so we'll look and see how that's done. So of course, we know all these important factors about bloodless medicine and surgery programs, that patients who are in these programs are refusing red blood cells, white blood cells, platelets, and plasma, that it allows individual decision-making, that there's alternative strategies or, enhanced strategies really for clinical management for patients, because as we've learned, especially on these conferences, that patients who are not transfused, they actually do better clinically. So again, it's an optimal healthcare outcome, but also that these programs are developed to facilitate that process, to kind of build that connection between understanding and practice. And so one of the things we want to consider is, we may know all these things about the importance of the program. We may know all these things about the impact of anemia and blood loss, but how much does our patient know? Regardless of how much we understand, how much do they understand, and how much have they been informed about their options? So again, benefits of bloodless medicine and surgery, but how are we communicating this to our patients? So again, are we giving them the information and developing tools and strategies and education and resources for them to choose the better option? We know it's a better option. We know it's a safer option, but in what ways that communicated to them? And again, what resources do we provide to get them to that point where they know how to make this decision, that they don't want blood, that they understand the benefits of a bloodless medicine program as well. We do know that patient blood management is definitely strategies that extends to every patient, because again, we should implement these very beneficial strategies to everyone. And bloodless medicine is more of a specialty for patients who under no circumstances will accept blood products or blood transfusions. But again, how much do they understand about the actual programs, besides the fact that a majority of patients who enroll in the bloodless medicine program, a huge driver for some patients is religion. And then you have a smaller percentage that will know a little bit more on the clinical side and may refuse because they know the implications as far as outcome. But again, it has a huge, a larger effect for the overall population. So again, we need to make sure that that's understood across the board. So as nurses, a big part of the framework that we contribute to building is that the nurse is a big part of the primary assessment. So in a lot of cases, when a patient starts to become hemodynamically unstable, or a patient, again, is not fully aware of what options they have, or their labs, or maybe their past medical history has a huge impact on how a procedure may go, and considering the best approach for this patient. That pre-assessment, in most cases, the nurse is a big part of the front lines, a big part of being a gatekeeper. And so when that patient starts to really deviate from what we consider normal or optimal, your nurse is going to be a big part, especially your bedside nurse.
I think she needs to go out.
Can you see my screen?
Yes.
Okay. Is really a big part of identifying these changes sooner than later, because we all know that early identification leads to early intervention. And so how do we, again, keep close eyes on monitoring this patient and picking up on even the subtle changes, even a change in their vital signs, a small change in their labs when there's a change in the pattern, or even a change in the patient's neurological status, which are early indicators of a patient decompensating. So with that being said, that's assessed early on, that's communicated across the healthcare team in order to allow all disciplines to really intervene sooner than later. But even prior to the hospital admission, the evaluation that goes into place, again, educating the patient so they're aware of what their options are, how to manage how to prevent anemia, how to manage anemia, and also those strategies they need to implement even when they're home. So again, we want to keep in mind that the nursing role, even in bloodless medicine, even in the hospital, has a huge is hugely impacted by the nurse being involved in the primary assessment and also early intervention as well. So again, we know the impact of anemia in hospitalized patients. We know the negative outcomes. We know that we want to avoid a blood transfusion. But again, as I always say, is how much does the patient know? How aware are they? We know in the community, we hear patients all the time discuss, hey, I think I may be anemic. And they don't think it's a huge deal. You hear them say things surfacely like, hey, I'm eating ice chips today. I'm always cold. I think I may be anemic. And they don't think that it's a huge deal. But we as clinicians know that it is. So again, that driver, that impact, and making sure that the community is educated as far as what anemia is, how it affects them as a patient should they ever become a patient, but also how it contributes to them even becoming a patient in some cases. So even in everyday life, what are some measures that patients can take to, again, stay in the loop and engage with their providers in advance to have those necessary labs and preventive care done to avoid being in anemia and being monitored on a regular basis. But also, what are some strategies they can implement even at home on a daily basis, vitamins, certain routines that they can do at home to even prevent anemia or even identify it early. So anemia evaluation and planning, again, hugely driven by healthcare providers, but again, your nurses being at the front line. So in many cases, even when it comes to your anemia clinics or patients that are coming in outpatient offices for PCP visits, and your patients that are in the hospital for pre-admission testing before surgery. These are labs that, again, your nurses are going to draw, your nurses are going to send those labs off. They're typically going to see them first. And when they see anything that's abnormal, they're going to report that to one of the advanced practice providers for an intervention. And as brought out in some of the previous presentations earlier this week, we know these strategies and we don't want to just do enough to get them through it. But again, we want to be meticulous in how we do what we do. So again, the nurse, drawing those labs, how much are we drawing? How are we sticking the patient to get that blood? We want to keep that in mind. Again, when we talk about in nursing, when I became a nurse in 2007, it was a whole thing where if a patient had had a central line. We would draw waste first, and then we would draw blood. So we really want to consider what techniques are being used when even these strategies such as phlebotomy are being done, when invasive techniques are being done for these patients as well. But again, the nurse is a huge part in those strategies that really could help optimize a patient's outcome by evaluating early, assessing early, but also performing any invasive techniques and preventive techniques to enhance the patient's outcome. So again, we also about continuity of care, because again, healthcare or overall health is a cycle. So again, there are all these components to it. So we always have the surgical and medical components that are crucial, right, for a patient, especially when they're already in that phase of crisis. But then there's all these pieces that have to happen beforehand, because we want to make sure that our patients, again, that they're informed, that they have the education that they need to make an informed decision. So are they aware of their options? Are they aware of the risk? Are they aware of the benefits? And so it really should be a care team discussion. And in many cases, and healthcare providers, we're definitely doing better with this, but there's this huge gap in literacy, understanding healthcare education. And so what we're learning is that even where we're simplifying conversation and not using heavy medical jargon, and really trying to use certain analogies and education to bridge that gap and knowledge with the family members and patients. We also want to do a good job evaluating how much they understand. And when we get an understanding of where they are, we want to meet them where they are. So again, really determining from an individualized standpoint how much they understand, what we need to do to mitigate that gap to meet that person where they are. And again, that differs from person to person. And we'll talk about some additional tools that some programs use to, again, make sure the patient has the information that they need to make this decision. Some of the things that I'll go into place to make sure that we are able to communicate those decisions are the consent forms that we do with patients, which also helps us to produce digital and physical identifiers to identify that patient as refusing blood products or blood transfusions. But again, all of this happens once the patient is educated enough to be aware of their options, but also to execute things like an advance directive that we'll talk about shortly. So again, it should always be a collaborative effort across the healthcare teams, where the bloodless medicine team and all disciplines really becomes a part of their care. So again, nursing being a crucial or core part of that medical team to ensure that that is there. So we do know as providers that trust is a factor, that a lot of patients won't even listen to certain, won't even have certain conversations or make certain decisions because the trust factor is an issue. But we do know that there are disciplines that patients may view as dependable and trustworthy as well. We want to make sure that that's a huge part of the implementation of plan of care piece. And so having that trust factor and that relationship and that rapport really does help to, again, meet a patient where they are, kind of help them understand the benefits, but also help to execute those tools that will help the patient make decisions that are best for them and healthier for them, but also to communicate to us exactly what they do want so that there's no discrepancy or confusion about their decisions for their health care. So one of the things that, just go back some. One of the things that I want to highlight is that not too many individuals that are not healthcare providers give a lot of thought to, if I can no longer speak for myself, who speaks for me, who makes these medical decisions for me. And in some cases, people may have in their head a decision maker as far as who that person should be. But the reality is, if it's not executed in a legal document, there are certain state laws that dictates who does get to make that decision. And so for the state of Pennsylvania, this is the hierarchy of the healthcare decision maker in the case that a person does not execute legal documents like an advance directive. So in the case that there are no forms, it defaults to the person's spouse. If that's not an option, then their adult children, and then the parents, adult brothers and sisters, grandchildren, and so forth. So that's something to keep in mind, because we want patients to know that if you don't make a decision about your health care, the state will, so we definitely want to empower them by making them aware that is very important that they have an advance directive, especially for our bloodless medicine patients, because sometimes the reasoning behind opting not to take blood is an ethical decision for a lot of our patients. But that doesn't mean that their family members are those ones that may fall in this hierarchy as a decision maker should they not execute an advance directive. Doesn't mean that they will respect that decision or even have the same belief system or would agree, especially if the person's life was at risk and they didn't understand all that entailed. So I'm just gonna go this way first. Okay, so for our Jehovah's Witness patients, typically, of course, they have the no blood card that's advance directive, which is very helpful in deciding what that person wants done in their behalf should they no longer be able to speak for themselves, as well as identifying a healthcare agent and an alternative healthcare agent, and that's very helpful. But when we get to our programs, and every program is very different in what kind of form they execute, but you want to have a hospital, or we have a hospital specific form that speaks to, you know, who they want to identify as a healthcare agent, what they are refusing, specifically for our bloodless patients, those red blood cells, platelets, plasma, white blood cells, but also a checklist that accompanies it to identify which derivatives they may be open to accepting. But also that form ensures that there's an education piece that they understand what they're signing. So this form allows us to get information to determine what they do and don't want, but also allows the patient to see what their options are and make an informed decision, because there's an education piece in there as well. So they're not just signing a contract that really speaks above what they may understand if they're not a clinician. And this advance directive should be accompanied, as we all know, by a detailed conversation and education by our bloodless medicine and surgery team while the patient is completing this. So some of the tools that can be developed as a result, one second. Some of the tools that can be developed as a result of having that conversation to provide an education are really quick fact sheets. You know, patients are really good about having certain conversations, but we do know, like with anyone, especially if it's not their specialty, people will walk away from that conversation, and as time progresses, either that's archived information and they don't remember the details or don't remember the rationale behind what was just discussed. And they definitely may walk away with their own interpretation of the conversation, especially if they're talking to additional individuals, because that's what we do sometimes. We go to an appointment and then we go home and we talk to someone close to us, maybe a spouse, maybe another family member, and we reiterate exactly what happened in that conversation, but it doesn't sound the same. It's not the same information because it may not fully be understood. And so again, it's really important because we always want to make sure that patients are able to walk away, whether they're enrolled in a program or not, or just have access to an educational tool that provides detail as far as what their options are in a very concise but detailed way, so they can get to the fact of the matter. But also, most importantly, for our programs, how to utilize the program. We know a bloodless program exists, but what are the steps to be enrolled? What are the steps to get more information? What are the steps to be followed as a patient to make sure that I have an advocate to ensure that my wishes are absolutely carried out and that we can have this ongoing communication. And so that framework with other disciplines and nursing being involved helps to produce educational tools and resources that really help contribute to the framework of a bloodless medicine program, but a patient being informed enough to execute an advance directive and understanding that if they don't make a decision for themselves, a decision will be made for them if they do not, even from a legal standpoint. Also, again, as everybody who has a bloodless program knows, this also helps to develop other identifiers, these physical identifiers that we talk about, that helps to enforce to the healthcare team that this is a patient that's refusing blood products. So in summary, and this was one that most of them look the same. This is one that we did for Lincoln All Hospital when we were building that program. And then we have the patient arm bracelet that accompanies the regular patient bracelet for patients that enter the hospital, and stickers for their chart as well, like most bloodless medicine programs have as well. And so in summary, we just want to highlight that all disciplines are necessary to have a successful bloodless program. And we just wanted to take the time today to really emphasize the importance of the role of the nurse in the bloodless program as a driver and developing these programs and really enforcing the strategies, but most importantly, that communication and relationship with the community and patients so that they can make an informed decision and feel empowered about their decision. The Bloodless Medicine program is important in facilitating all these pieces because we know education, again, helps facilitate decision making, research, workflow, and processes. So it really impacts how we do what we do and why we do it, and also to achieve optimal outcomes for our patients and continuity of care as well. Just a few references, and that is it. Thank you so much.